we're going to continue with presentation from Bart Vanhrecke, Director of the European Social Observatory, and Slavina Spasova, who has been the lead author of a recent ESPN publication on long-term care. So I'm going to hand over to my colleague on the left, so off we go.
Yes, thank you very much, Alan, and thanks very much, everybody, for accepting these harsh working conditions. Skipping a coffee break is a very dangerous thing to do, but okay, we all had our quick cup, so thanks for staying with us. Many thanks also to the Sprint project partners for inviting us here today to add our small edifice, stone to the edifice. We'll build on what Anna Carla and Virginia have said, and also on the Italian case study. We've been asked to look at the nexus between social investment and long-term care, of course. We'll say something, and I'll be controlling my slides from here, and then the colleagues over there apparently will follow or something like that. I don't know how that works, but you will figure it out. So we'll talk about social investment as an EU social policy paradigm. I'll explain that's how it was intended, but it didn't really work out that way. And then Slavina, who indeed was the lead author of our report on long-term care, will discuss national challenges in national systems, look into national reforms and ongoing policy debate, and then we'll end up with some EU level and national policy recommendations. So that's what we want to do. So I'll start with social investment as an EU social policy paradigm. And of course, we have to start with the good old social investment package. I don't have to explain to anyone here what that is, even though we don't see a lot of it anymore. We know that it was launched in 2013. What maybe we don't all agree on to begin with. Let's see if we need to discuss this. In our view, this social investment package was really launched in 2013 by the then Commissioner Laszlo Andor, who was still a very active proponent, of course, of this old idea. And it was launched not just as an idea, but with the ambition to be the new EU social policy framework. It was meant to be a new policy infrastructure, at least that's how we read it, that would be helpful to manage the various elements of public policy at the EU level, from identifying problems over agenda setting to implementation. So very ambitious to begin with. I think this ambition was reflected to some extent in this 2013 Commission staff working document, which of course you've all been using and citing, and which we've already heard about, namely the long-term care in aging societies, challenges and policy options working staff documents, which of course was part of the social investment package, favored social investment approach to social protection, which decreases the need for long-term care, focuses a lot, as we know, on prevention, on rehabilitation, on productivity and capacity gains for innovation, but also, of course, on quality assurance. And it calls for developing new ways of closing the gap between long-term care needs and provisions. And so there was, I would say, quite ambitious document at the time. 2013 is quite a few years ago. And I would say a quite smart framing of the nexus between social investment on the one hand and long-term care on the other. Because why smart? Well, because of course the link, for example, between investing in children, leave scheme for parents, and these kind of topics and social investment is quite obvious, I would say, and it was quite easy for the Commission in a way, but also for other international organizations like the OECDs to even build a business case for this kind of social investment. We remember that the subtitle of the SIP was Growth and Cohesion, right? For long-term care, of course, this is far less obvious. This was far less obvious because they are, of course, aimed at long-term care is aimed at the frail and the elderly, their well-being, and it is, let's be honest, quite a far stretch from the pure idea of social investment, and the business case for this is not so easy. But as I said, I think the Commission made quite a good attempt at framing this nexus by indeed referring to the elements that I've already referred to just before. And linked social investment lead to long-term care policies by pointing to prevention, rehabilitations, etc. If you want to know more about that, we wrote in 2015, the very first report that we wrote for this European Social Policy Network, that I will come back to in a moment, was about social investment. Those who haven't seen that yet, it's still time to go and pick it up. It's still on the Commission website. Now, to wrap up my part of the talk, I think it's quite clear that social investment never really worked as an EU policy framework. Unfortunately, I dare add. It was embraced especially by the academic community, and I'm happy that, in this kind of circle, social investment is still very much alive. Also by, I should add here, Virginia, having listened to you, EU social stakeholders who have been working very actively and even proactively with the concept of social investment, but unfortunately it hasn't been picked up by national policymakers, nor indeed by national stakeholder organizations. So I will have to amend my slide. Thank you, Virginia. I think part of the explanation is that, well, it was launched at the time by DG Employment of the Commission, by a particular commissioner. I don't think it was carried by the Commission as a whole. I don't think President Barroso was a very big proponent of social investment, and quite clearly, I would say, but we have the Commission here present to contradict me if needs be. I think the new Juncker Commission, in its first years, didn't really use the concept for several years. Now, does that mean that social investment is off the agenda? No, it's not, of course. So it's not a black and white story. It didn't work as a policy paradigm or a policy framework, nor has it disappeared from the agenda, not only because academics and EU stakeholders keep on talking about it, but also indeed, and I have to acknowledge that, in the multi-annual financial framework or the proposal for the next period, in the proposed European Social Fund Plus or ESF Plus, indirectly in some of the country-specific recommendations, as well as different years of the annual growth survey, so the key instruments of the European semester, there are indeed direct or indirect references to social investment. So it's still out there, not as a policy paradigm or a policy framework for EU social policies, but still as an operational concept. So I think there is some gray between the black and white. Most importantly, it's there under the radar, I would say, in the context of the European Pillar of Social Rights, which is, of course, now the new EU social policy framework. It has, in a way, absorbed the social investment package. It's more than the SIP, but it has absorbed it, I would say, including with regard to long-term care. I don't have to repeat this. Anna Carla already referred to Principle 18 on long-term care. So this is one of these instances, Alan, where I will cut it short. Now, the question with regard to long-term care and discussion it entails about social investment, or one of the questions is how to reconcile financial sustainability challenge with challenges relating to access, to adequacy, to employment, and to quality. And precisely this question was at the core of a report that we produced it seems so long ago, but actually it's not so long ago, on challenges in long-term care in Europe in the context of the European Social Policy Network, which is a Commission-funded research network. So we provided it, or we did this analysis drawing on, as you just asked me during the coffee break, Virginia, what is your material? Well, we are so lucky to have each time 35 national country reports produced by expert teams, academic and other, in the 28 member states and some other non-EU countries. and what we do then at the European Social Observatory, but also at LISER and Applica, is then write synthesis of these national report. And the one that Slavina Spasova, who was the lead researcher on that report, will now zoom into, was of course the one on long-term care. So please, Slavina, the floor is yours. And the colleagues are still following over there, so everything's fine.
Good afternoon, and thank you for the invitation. I will continue with the four main challenges which were identified in our report. I will try not to repeat what Anna Carla already said before, but we'll try to provide some more examples and try to be not too long. So the first challenge is the challenge of access and adequacy. The second one linked to the quality of long-term care. The third one, the employment challenge, and finally the financial sustainability challenge. As for the challenges of access and adequacy, access seems to be hindered in many of these 35 countries by an interinstitutional and territorial fragmentation. Many ESPN experts pointed to the not always clear division of responsibilities between the healthcare and the social sectors, and also not so clear division in, between territorial entities linked to provision of long-term care. The second challenge related to access is deinstitutionalization. When we started working on the report, the Nordic members of the network, they said, well, for us it's quite clear, we have a problem of deinstitutionalization in our countries. And what we could see is, it's true, there has been a prioritization of home-based care at national level and also in EU discourse, but what is quite clear of these 35 reports is that there are two main trends. First of all, indeed, Nordic countries and some continental countries with long tradition of residential care have been reducing their residential places over the 10 past years, and even before for some Nordic countries, while there is another tendency in southern and central and eastern European countries which do not have such a tradition of residential care, and we see here a tendency towards a creation of residential places. And let's have a look at this figure. Let's have a look, for instance, on Sweden. It's the tendency of reducing residential places is quite clear, while just next to it, Spain, we could see the opposite tendency. Again, an overview. So in the Nordic countries, the number of residential beds for persons 65 plus has been steadily diminishing since 2005 in some of these countries, and it became a common trend after 2010 in all of these countries. But still, these countries have among the highest percentages of long-term care recipients in residential facilities. Moreover, in these countries, home care and community-based services are the most developed among the 35 countries under scrutiny. And we could see some good examples of social investment in rehabilitation. And here the Danish report is quite interesting if you'd like to have a look. It's on internet. As for continental Europe, the trend is less pronounced. There has been a slight decrease and then followed by a slight decrease. And here Luxembourg is an exception. The country doubled the number of beds since 2001. Again, in these countries, we found out that there is well-developed home-based and community-based services compared to, for instance, the Southern European countries and the Central and Eastern European countries. In the Southern European countries, we see a clear trend towards an increase in residential beds, so we can't talk about deinstitutionalization in these countries, and at the same time, there is insufficient availability of home-based services. The situation in the Eastern European countries is similar, though it's less clear-cut. There has been a slight decrease in the number of residential beds in some countries, but it also depends on the sector, whether it's the health sector or the social sector. There has been a steady increase in the number of residential homes in Bulgaria and Romania, for example. The Romanian report in this sense is very interesting. It shows how especially private homes have been developing. And then in these countries there is a clear, we could clearly see that there is an underdevelopment of home-based services. We also concluded that the Central and Eastern European and the Southern countries are facing similar challenges. The demand is exceeding the supply of long-term care, and this is due to changes in family structure, increasing in the pensionable age, especially for women, and immigration. What about adequacy of long-term care? As Anna Carla already referred, there are no indicators. Only some countries have some indicators on how to measure the cost of long-term care. And so we asked the ESPN experts to provide some specific examples with administrative data. And here we could see that the German expert pointed to the decrease of the purchasing power of benefits in their country. And for instance, the private costs for long-term care amounted to 36% in the total expenditure on long-term care. In the Czech Republic, the monthly care allowance for heavy dependency is estimated to cover approximately 2.5 hours of care per day. We also tried to somehow measure the sufficiency and the affordability of long-term care through the indicator on private expenditure on long-term care, which is the highest in the UK, Ireland, for instance, and afterwards I will show you that these were also the countries which had important budget restrictions during the crisis period. Another feature related to affordability of long-term care, some ESPN experts, for instance, from Belgium, UK, Germany, they pointed to the marketization and the privatization of long-term care as an issue of affordability for long-term care recipients. And finally, a good news, let's say, there are also some examples of social investment to improve access and affordability. For instance, in Estonia, there is an interesting example of the use of the European Social Fund in order to improve access and especially to home long-term care services. The second main challenge, the challenge of quality, which Anna Carla addressed already, what we found regarding this challenge is that there has been a constant refinement of standards over the past 10 years. However, the quality of long-term care remains still a problematic issue in most of the EU countries. And here, requirements vary substantially according to the type of care, residential care or home care. Home care remains mostly unregulated, and according to the sectors, the social and the health care sectors, I mean, in some countries the health sector has clear and well-established standards in comparison with the social sector. The third challenge, which also Anna Carla already addressed, is the employment challenge. I won't go into details. Here I would like to refer of what my mentor in long-term care policies and work-life balance Denis Bouget calls the invisible social welfare scheme. Today in 2018 we see that long-term care is still a family obligation in most of the ESPN countries, fulfilled mostly by women and generally without any direct compensation. The reasons which were highlighted by the ESPN experts are the shortage of accessible formal long-term care facilities, the poor quality of long-term care in some countries, the non-affordability of long-term care, and also the traditional model of intergenerational and family relations, which is still well enshrined in especially Southern and Eastern European countries. And here, Anna Carla already showed you a graph on inactive people looking after dependent people. Here, and as she already pointed, there is no breakdown per age, so we don't know who cares for, how many people are caring for elderly, but we could suppose, because women in literature, women and men of the age group 50 to 64 are most likely to look after elderly than after children. And what we could see in this graph is that, unsurprisingly, we women look more after people, almost 6% compared to men, 1.4%. And here the UK and Ireland are topping the charts, while, as you could see, Nordic countries, for instance, Norway, Sweden, they have among the lowest values. And what we also found, unsurprisingly to all of you, there is a great variation in the support for the carer, in care leave, cash benefits, social insurance coverage, flexible working arrangements. In general, what we found is that there is a lack of adequacy of provisions according to the needs, and also there is a lack of awareness. Apparently, there is a low take-up in some countries, especially regarding care leaves. As for services of carers, they also vary widely, and what was pointed out by the ESPN experts is there are rarely services available for cares for the elderly. There are also here some good news. For instance, some countries have been implementing policies for investments in carers. For instance, Poland have implemented a benefit to support the labor market reintegration of carers using subsidized employment measures. And Portugal and France have been reforming their schemes, and they have been implementing various support measures for informal cares over the past 5 years. As for the last challenge, which has been discussed lengthy here, we know that public expenditure, depending on the projections, is projected to increase by 70% between 2016 and 2070. What we all know is that there is a great diversity in spending. In general, Nordic and continental countries are among the leaders in expenditure, while Central and Eastern European countries score the lowest values at around 0.3%. And in our report, you can find different examples, country-specific examples of how countries are trying to deal with this challenge of sustainability. But there are also some common challenges, and they are also similar to the challenges. They are linked to the challenges to access to long-term care. This is the fragmentation of care, lack of coordination between health and social entities, and the lack of clear financial strategies of the territorial entities responsible for long-term care, which leads to unpredictability of long-term care spending in many countries. Finally, what we found in terms of conclusions on reforms and debates, things are really moving. Long-term care provisions have been subject to several reforms in most of the 35 ESPN countries over the 10 past years. And here we try to group these reforms in some trends. There are three main trends. The first one is the readjustment of the long-term policy mix. As I already said, there is a clear move away from residential care towards home care and community care. There have been, in several countries, measures addressing the financial sustainability that I already mentioned, the importance of budgetary restrictions in some countries during the crisis period. But again, there are also some measures going to the direction of better access and affordability of provisions, including the improvement of the status of informal carers. For instance, increased long-term care funding in Estonia and Romania, improving eligibility conditions and benefit levels in some countries, tackling the above-mentioned interinstitutional and territorial long-term care fragmentation, and finally, recognizing and improving the status of informal carers. And here the Czech report is quite interesting to be read. And finally, I will finish with some policy recommendations. Based on these challenges, we provided a battery of recommendations. Here I choose only 4, which are linked to the conference today. First of all, we believe that development of formal home care and community-based care should be priority in all countries, but there is a clear need for appropriate funding in order to ensure accessibility and affordability of provisions. We also believe that while prioritizing home care over residential care, countries should avoid policies which reduce the supply of residential institutions without providing sufficient home-based services, and this is what we see in some countries for the moment. As for informal carers, it's important to invest in carers. Stronger support should include improved social security rights for the informal carers, providing adequate training, upskilling, and recognition of skills, and enhanced possibilities to remain in the labor market through flexible employment, part-time carers, awareness of the existing measures, etc. And we also provided some recommendations to the EU level. First of all, we believe that in implementing Principle 18 of the European Pillar of Social Rights, the EU should pay attention to all strands of long-term care and ensure a balanced approach between the home care, community care, and residential care. And this should reflect the different needs of dependent person. And finally, we saw in Estonia, for instance, we believe that the use of EU funding, notably the ESF Plus, should be promoted to develop home care, assist in the improvement of skills, and support the informal carers, and especially in countries with the least developed long-term care systems. Here you could find some of our publications on long-term care and work-life balance, and thank you for your attention, and me and Bart, we are available for questions and comments. Thank you very much.
Thank you.